Well, for years, I was seeing a gastrologist in Syracuse, New York, that was treating me for hiatal hernias and gastritis for many, many years. And over the last couple of years, they actually found some cysts and tumors and masses and different things that were just ironically just showing up in different parts of my organs, and just kept saying, we're going to leave it alone. I didn't like the answer. So I got referred to SUNY Upstate in Syracuse, to Dr. Osden. He found the pancreatitis because he listened to me. He made me part of his team instead of treating me like an outsider and just quickly coming to a result and treating me just for the next common thing. He promised me that he would get me the best care. And he referred me to Dr. Schwartzman and Dr. Gruessner, and I looked them up and I was so excited. I felt like a great bunch of relief that had come to me, gave me peace of mind, because they were top notch. I knew that being put into the right hands was going to take care of me. When I initially was told, what I had, and I came here, it was more convincing them that I really was sick. The test results were there, but looking at the outside wasn't there. It wasn't the norm. So I reminded them, you can't trust the book by its cover. Don't judge me by the cover. As I was going through the last couple of years, I just noticed something was wrong, because I was constantly fatigued. It was hard to go get something to eat with a bunch of friends or make plans because I'd have to cancel. I was always in pain. It was very hard to sleep at night, just having severe chronic pain and through my stomach and right through the entire back. That I was getting more sick by the day. I was feeling like so much worse every single day. And it's taken me 4.5 to 5 hours to drive down here to go to the lab and meet the team. And I get here, and the guy that's seeing me to do all my lab work is panicking, and he's so concerned about the time that I've already driven down, and that it's going to take a lot of time for me to stay here at this hospital to have all that lab work done. He was so concerned. He was like panicking, and I'm like, no, just calm down. Let me give you some of my joy oil, make you feel better. He was just really concerned about me. And that's how everybody on the team is. They're really, really concerned about you. When you're in front of them, you're the only thing that matters. When I met with the endocrinologist, they were upset that I didn't have anything to test my blood sugars. I didn't even know what blood sugars were. I don't know anything about diabetes. My brother has it severely. My grandmother passed away from it. But I didn't know that a lot of my symptoms were diabetic related. I had no idea. And that was one of the things that was going really bad on me. Making me feel so horrible at different times of the day. And even like I would get up and shower and then have to turn around and lay back in bed, and that's just not me. When I went to endocrinology, they made sure I had a kit to go home with that day. They taught me how to use it. They took the time for me, said, you cannot go home without this. I'm not letting you go home without this. Those are heartfelt, true life things that happened to me my first visit here. It's phenomenal. You can't judge a book by its cover. The brick and mortar of this building has nothing to do with the people that actually work and support the sick. Is phenomenal. I did my research. On who was taking care of me. Dr. Schwartzman, Dr. Gruessner, they're top notch. You can't get much better than that. And actually, all those departments that I had to go visit to do all my preliminary work was so amazed. He said, do you realize who's working with you? You know who your doctors are? I said, oh yes, I do. He said, who are you anyway? How do you get there? How did you get these guys? I said, well, I have an angel. Somebody from Syracuse, New York knew the right people. And he promised me, so I'll make sure you're put in the right hands. And he did. I'm looking forward to go home, get in my own bed. Finger pricking these fingers, and that's going away. I'm looking forward to that too. I've had to have my fingers pricked every 15 minutes for 2 days, every half hour for a few days, every hour for a few days. They are all spongy feeling. I'm going to look forward not having to do that as often, not being woke up every hour. But you know what? That's what had to be done. I had 2 surgeries. One was taking the pancreas out. The second day was putting the islets in my liver. I'm grateful to everyone here at Downstate Medical Center. They've been phenomenal. The nurses have been phenomenal. The kitchen has been phenomenal. The cleaning people have been phenomenal. To see all the support around this team is phenomenal. It really is. Just keep doing what you're doing because you're doing the right thing. Don't ever second guess what you're doing.